My name is Stephanie Lovelace, and I'm going to be talking to you about postpartum depression. Having a baby can be both an exciting and stressful time for a new parent, and there are many times that the mothers experience some form of depression after delivery. It is relatively common for a new mother to experience the baby blues after having their child due to their upset hormone levels and the changes that they are going through. These feelings of sadness should not last very long, and they usually go away after the mother's hormones get back to normal. Even though the baby blues usually go away without treatment, there is a bigger problem that the mother could experience after childbirth known as postpartum depression. Postpartum depression is a more serious condition that shares many of the same symptoms as the baby blues, but these symptoms are more severe and should not be ignored. Postpartum depression affects women after childbirth, and it can be a sudden onset or occur over the period of months. The exact cause of postpartum depression is unknown, but there are many causes and risk factors that contribute to the problem. The causes of postpartum depression are associated with the changes in the mother's hormones, physical changes, and the stress that occurs after giving birth to a child. Each of these things affects the mood of the mother, and it can increase the chances that she will suffer from postpartum depression. There are also multiple risk factors that increase the chance that the mother will have this disorder, like having a previous history of depression, a lack of support from friends and family, relationship problems, medical complications for the mother or the baby, being at an age under 20, using alcohol, drugs, or smoking, having an unplanned pregnancy, or we're experiencing mixed feelings about the pregnancy, having issues with money or housing, having experienced a traumatic event during the pregnancy, or having a close family member that has problems with depression. These risk factors increase the likelihood that a woman may have postpartum depression, and there are multiple symptoms that they should look for. Some of the symptoms associated with postpartum depression are a lack of interest in the baby, negative feelings towards the baby, worrying about hurting the baby, a lack of concern for themselves, a loss of pleasure, a lack of energy and motivation, feelings of worthlessness and guilt, changes in appetite or weight, sleeping more or less than usual, and having recurrent thoughts of death or suicide. Postpartum depression is a serious condition that should not go untreated because there are many issues that it causes in the lives of the mother and the baby. Experiencing the symptoms associated with postpartum depression makes it hard for the mother to properly take care of herself and the baby, and this can have a real impact on the baby and their future. Having a mother that is suffering from depression makes it hard for the baby to form a secure attachment to their mother, and this can lead to many issues down the line. These issues include behavioral problems, delayed cognitive development, social problems, emotional problems, and even depression. These are not good things, and these are not something that a new mother wants for her baby. Most mothers want their children to grow up to be healthy and strong, and this starts with her. There are multiple options out there for these mothers, whether they want to practice some self-help techniques or get professional help. Some self-help techniques for dealing with postpartum depression are getting plenty of rest, making time for themselves, making meals a priority, getting out into the sunshine, easing back into exercise, making relationships a priority, talking about their feelings, and even joining a new mother's group to discuss the problems that they are having. If these self-help techniques are not working for the mother, then she may need to seek professional help for dealing with her depression. The professional help that a mother with postpartum depression can receive is similar to the treatment for other forms of depression and includes counseling, hormone therapy, and/or antidepressants. If a mother with postpartum depression does not get the help that she needs, then she is putting herself and her baby at risk. If postpartum depression is not treated, the condition can go on for months or even years and can continue to get worse. Having a case of postpartum depression that goes untreated increases the risk that the mother will harm herself or her baby. In other words, the longer that the condition continues on, the worse that it can be on everyone involved. For this reason, it is important for the mother and others around her to pay attention to the symptoms associated with postpartum depression so that it can be caught early on. The mother should seek medical help if she notices that the baby blues last longer than 2 weeks, her symptoms of depression get more intense, she is unable to tend to herself or her baby, or if she is having thoughts of harming herself or the baby. Seeking help and having a good group of friends and family is the best way for a mother to deal with the condition and to recover from its effects. Having a good group of friends and family members helps to reduce the seriousness of the condition and helps the mother to cope with all that is going on. There are also some coping tips that can help the mother to deal with all that she is experiencing that include finding someone to help with childcare, errands, or housework, taking some time to do something that makes her feel good, keeping a diary and keeping track of her feelings and thoughts as she begins to feel better, giving herself credit for the things that she is able to accomplish, giving herself permission to feel overwhelmed, remembering that no one expects her to be perfect, and asking others to help her when she really needs it. All of these things will help the mother on the road to recovery so that her and her baby can live healthier and happier lives together. Thank you so much.